All right, everyone, Dr. Tam and Rocky here today for another amazing episode. Rocky, we've got some good questions today. I read over the questions earlier.
Mhm.
Go ahead, let's rock and roll.
Right. Yeah. We talked about peripheral neuropathy in, a lot of our videos, right? And in one of our videos, we talked about what it is, the causes, the symptoms, and most of our viewers, for most of our viewers, rather, the term peripheral neuropathy can be overwhelming and, even scary. So people can even get anxious when they get diagnosed with it. So, the first question that we have, Dr. Tam, is peripheral neuropathy permanent? Do I really have to live with it until the rest of my
Well,
life?
that's one of the big misconceptions is that peripheral neuropathy is a permanent thing. The science actually shows as long as your nerves are not over 85% damage, it doesn't become permanent. And there's a chance
Mhm.
that symptoms can actually be reversed and start getting better.
All right. Okay. Well, that's
Yeah.
definitely great news. Now, there are also some cases where they get misdiagnosed, right?
hmm
What are the common misdiagnoses or the common mistakes when making diagnosis about peripheral
Yeah.
neuropathy?
So some people get neuropathy. And really, what peripheral neuropathy is just that there's a disease of the nerve that is in your peripherals, which is your hands or your feet. That's all it really means. So, whenever someone has nerve damage or nerve pain, they can get diagnosed with peripheral neuropathy. Now, a lot of times in Western medicine, we're told to cover up the symptom, right? Just cover up the symptom with a
Right.
medication or whatnot, and that's it, right? So when the medication wears off, if the medications are not strong enough, now you are prescribed even a heavier dose of the same medication, or they switch up the medication. But what we have seen is as long as you do things the right way, a lot of the symptoms are actually reversible. Science has proved it already, you see. So it's something that we're doing that's really amazing. But that magic number is 85. Once it hits that
Hmm.
85% nerve damage, I mean, that's where it becomes really permanent.
Yeah, and um, talking about covering up the symptoms, mostly people uh, are given prescriptions, right, for pain, and a lot of these prescriptions have side effects,
Yeah.
right, which are really something that we don't want to have. But um, speaking of nerve damage, Dr. Tam, what are the top three things that you should avoid knowing that you already have nerve damage?
Well, we have to look at what's the cause of that peripheral neuropathy. What is the cause, right? If it's diabetes, then you got to stay off the sugar because sugar is what's feeding all the terrible, the sugar feeds off the blood vessels and it eats away and tears it down, right? So if you're
Hmm.
diabetic, you could get off the sugars, get off the carbs, and start eating a lot healthier, right? So we have ways
Right.
to show our patients and clients how to eat healthy. What's the best way to do it? It's not just a one size fits all. You really have to tailor it to the person as well. If it's,
Hmm.
alcohol induced, right, neuropathy, stop drinking alcohol, right? That's one of the big things.
Right.
That's how you got it to begin with. Now, not everyone can stop because
Hmm.
we've had people who've owned wineries that came to us and says, well, that's been my life. Me not
Yeah.
being able to drink wine for a few months, it's like it's going to kill them. I said, if you can't do this, then we can't help you. There's nothing we can do, right? And then
Right.
there is the idiopathic neuropathy. Most idiopathic neuropathy, it's either a patient's either on a medication or maybe they have a really severely compressed spine. So what we have to do is decompress their spine to make sure that they're no longer compressed and pressing on the nerve. Well, one of the things that those people need to start doing is to start not exercising with heavy load on their spine itself. And that's what's going to help.
Hmm. Right. Yeah, and speaking of spinal decompression, Dr. Tam, is it true that spinal decompression and massage therapies even can help in managing neuropathy?
Absolutely, because the nerves to your feet and the nerves to your hands comes from your spine, right? The nerves in your hands come from the neck. The nerves in your lower legs, in your legs in general, come from your lower back. So as long as you open up those channels, it's like opening up the floodgates. You open up the floodgates, what
Mhm.
happens is now blood and nerve flow is going to start being able to rush down to where it needs to be. If you look at neuropathy as a whole, think of a fist, right? If I hold up my fist, this is the nerve endings, okay? But if I squeeze it real tight, what happens? It blanches. So there's blanching, which means that it turns
Right.
white, right? So
Mhm.
what we do is with neuropathy is not so much we take care of the pain as much as what's causing this. It's the tightening of the blood vessels, the deterioration of blood vessels, and there's no nerve flow. Now there's no oxygen. Well, the therapy, angiogenesis therapy that we do with vibration therapy, rebuilder, supplements, and everything, well, that's going to unload the spine and unload the nerves and ultimately start opening. As you start opening that area, well, now my hand starts to get a little bit more red, right? I start to get blood flow. I mean, I could literally feel,
Right.
I was holding my fist for about 15 seconds here. I can literally
Yeah.
feel the blood coming back to my hands as I do this. You see?
Mhm.
And that's what neuropathy is once you get the blood flow back, that's that's a holy grail.
Mhm. Right, right. And of course, definitely exercise can help you get that blood flow
Mm-hmm.
back,
Yeah.
right? Now, um, aside from, because you talked about a few more therapies earlier, Dr. Tam. So, aside from spinal decompression and massage therapies, what else can we do about peripheral
Well, that's
neuropathy?
where the amazing light therapy that we do, which is the angiogenesis
Mm-hmm.
therapy, comes in, where we increase the blood flow. There's the nerve rebuilder that we're incorporating that helps rebuild the nerves. That's something that's been used for the Cancer Centers of America. When those people get neuropathy after chemo or radiation treatments, that's what they use to rebuild the nerves. There are supplements that helps accelerate that process, and also vibration therapy that's going to help that area as well.
All right. Okay. Well, thank you so much, Dr. Tam, for giving us very much valuable information about peripheral neuropathy. Because definitely, it's something that a lot of people miss and just ignore, and it can lead to more serious health risks, right?
Huge.
So definitely. Well, thank you so much, and I hope you enjoy the rest of the
Thank you,
day.
Rocky. Have a great day.